Hello and welcome to another episode of Hornbill TV's Health Docs. Good day, doctors, experts, or healthcare professionals can get anigna. Alag health topics can la obode kotha kuri na chai. Aro ajimuan kotha kurle lado alternative therapy treatment la obode howa. Eduhan ki ase guledo alternative therapy treatment under the alag methods therapies can be se like acupressure, acupuncture, cupping therapy, eduhan alag pishe ase. Aro mohan acupressure koile do it is one of the oldest medical practice still in use today. Aro mohan saishu koile do Asian countries do it has been practicing for more than 1,000 years now. It ya ajitapi exist ase. And then Nagaland la context te saishu koile do mohan Nagaland do manukan iman alternative therapy treatment goishu koile do manukan bishi najania labi ase due to ignorance. Aro people still think that it is not a legitimate medical practice. But then slowly, Nagaland bi catch up kurina chala mohandi pai. Aro Nagaland we have very few acupuncturists who offer these alternative therapy treatment and methods for people who cannot find solution from conventional medicine kanbra. To eduhan la opore mohan ge phal se janai di bole karne edu alternative therapy treatment do ki ase nulwi edu bra mohan la body de kinika pain management nulwi mohan la body de kinika modot kore eduhan la opore mohan ge koi di bole karne aji moi ge join kuri na ase Mr. Zapoto Venyo, Taido Manubishi Tage Bole Koiginabi Janibai, and Daido Huledo, he is a senior acupuncturist. He is the co-founder of Acu Healthcare Edu Chumugedima United Village Dease. He is also the co-founder of Alternative Therapy Treatment and Training Center, which is just here in 7th Mile Chumugedima la under data Edu training can be digna chala ase. So tai lodi bra mohan aji phal se eduhan la opode sob phal ra jani gina jawo. So thank you so much Mr. Venyo for joining Hornbill TV to share your expertise on this field. So yeah, so moijin etia shuru kurina jawole karne edu alternative therapy treatment ko do ki ase exactly what it is, and then alternative therapy treatment do kinika alag ase na from modern medicine aro mohan hospital treatment de jai na sai na. So edu taijun la alag difference to ki ase.
First of all, thank you so much, Hornbill TV. Thank you, Naomi, for giving us this great platform so that we can create awareness on traditional therapy. Alternative treatment, actually, it's very vast. But what we do in our treatment center is that we give acupuncture. So we give acupuncture, acupressure. So acupressure, we also call it shiatsu in Japanese term. We also do hijima. So hijima means it's a cupping, and also we do guasha, and we also do TNS therapy. So alternative treatment, it's a combination of traditional therapies, and also we call it TCM. So there's traditional Chinese medicine. The difference between ours and the medical professional is that we don't prescribe medicine. So we focus most on like natural way of healing. Okay. So we also give treatment to the most common problems. Yeah, so which we can discuss later.
Okay.
Yeah.
So mohan saina jaishu do alternative therapy treatment de manuhan kile ajigali do tahan kile ki karne ahena aro conventional medicine bra tahan ge any offer korle na pariala or in case kideba do tahan any treatment lui thakina bi kunba do tawai khai thage lui tan la bimari na thure aro heal na gura la bi thage. So tahan rahi bishi ahena edu how does it work?
Basically our people, I mean all of us in general, we want to heal our ailments in a natural way.
Yes.
So for example, we all want to eat organic food.
Yes.
So it's like they want to get treated in a natural way, so in a natural healing process. So so many of the patients or maybe different people, they are a bit skeptical about the side effects. So they feel that it's a natural process of healing. So usually they come for that process, I believe. Yeah.
Okay. So mohan Nagaland la context te saishu gulido edu common alternative therapies na edu manuhan loina thagela most common do ki khano.
Most common is acupuncture.
Okay.
So acupuncture, but we also give like combination. So every patient that comes to our clinic we try to see which therapy will be useful or which therapy will maybe like tightening the ball hobo. So we use combine. At least one therapy can like be benefited. So we combine all the therapy. And also I want to mention about what we started recently in our alternative treatment center is prevention therapy. So we are starting a new like prevention therapy. So prevention therapy can be availed by anyone, whether you are sick or you're not sick, anybody can avail. So prevention therapy means like it's about like de-stressing our body, detoxing our body, So so for those kind, we sometimes don't need acupuncture for normal cases. But if they have problems for maybe about 5 years, 2 years, or maybe they have prolonged problems, then that's when we use acupuncture also. Yeah.
So how long have you been practicing this alternative therapy treatment na? Aro idia tak kuri gina ahiya do kiman sal nishna hoise, and then Nagaland la context e sai shugulubi moi akiti kwa nishna, it's like a new concept na manu bishi bin na jane. So idia Nagaland la context e sai shugulu do key stage te ase like alternative therapy treatment la borde na.
Yeah. So when we first started, I think it was very new. It's a new concept to everybody. So my dad, he is among the first person in Nagaland to bring acupuncture. He is one of the first, not the first, but one of the first. But he's the first to bring acupressure. Acupressure and sojuk. So I forgot to mention, but sojuk is a Korean acupuncture, Korean style of acupuncture. So he is the first to bring acupressure and sojuk therapy in Nagaland.
So in which year was it?
Oh yeah. So my dad started his career. He got training from Japan. So he started in the year 1988. So my dad started in the year 1988, and I slowly pick up his work. So I have started in the year 2015. So till date from 2015.
So your dad also still practices?
Yeah, still practice.
Apni dujon bhi
Dujon
milai na. Okay. So edu idia treatment and benefits kan la opore saina jao mujun. So patient ekta bra ahina apni la alternative therapy treatment kan loise gole do taila how quickly can someone expect na healing aro edu khali one time treatment asna regular sessions kan thagina kinika, how does it work?
Yeah. So the first thing what we do with the patient is that we try to consult with the patient, about the history. So sometimes we have patient like with injuries, like past injuries. So we first try to talk to the patient, know all the problems, and after that we try to diagnose accordingly. So your question again?
Is it a one-time
okay,
treatment
one time
or continuous process?
We have a course. We have course. So course is like 3 session. So 3 session on alternate days. But depending on the health condition, for example, if we have stroke patient, so stroke patient, it takes a lot of time, and we cannot say that we can like stop bal ho jawo to do chances komti ase. So it takes a lot of time. So for a stroke patient, sometimes it takes around maybe 12 session, 6 session. But for basic problems like migraine can, or maybe back problem can, so they can feel the relief or they can feel improvement in just even 1 session also. So we have a testimony like manu walk ko na paina, girina walk ko na paina ahina. So after the treatment, they are able to walk and go home. So those, so it depending on the health problems.
Okay. So alternative therapy treatment do kun kan garni do apni an recommend no kore, like chronic patients disease kan illness kan thakise bole na enika ki kan kun kan do avail kore apni an recommend na kore?
Basically I can do pregnant women can get, or a person who has like any severe cases of problems like kidney bimar can, or heart failure can, or any things that are severe, right? On the side. So what we do is we try to ask them whether they have gone for medical checkup or no, or whether they have like went for treatment or no. It one first which one is like a bit severe risk loan upon one on the side.
Okay. So ki laga health issues kan palra apni an la therapy de respond kore, like pain, stress, ito kan na kundu wala hi bishi palga se.
It's like we look any most common kan na, most common problem kan, example migraine kan, back problem can, or maybe shoulder stiffness, or frozen shoulder, or maybe shin pain or like thigh pain can. So it's like most common cases kan amen side ke.
Manu actually bimar thai issue gule do taila bimar khan do first to kiniga side like apni akede bhi question history kan bhi hote na.
Yeah.
Traditional Chinese medicine kan bhi I've read once somewhere that chi la opore bhi belief thai na ina work rate. So how does it work?
So chi is like a form of energy. So in our theory, in our system, in our system to hole it's like yin and yang. So positive, negative energy and our body flow na. So example, if kuma jada ni blockage thagi like the energy is not flowing properly or the blood circulation is not flowing properly, idam de to blockage thagile tade bimar khan start ho jay. So example like I have mentioned earlier, so any person who has like frozen shoulder, so frozen shoulder to now the blockage comes downside. So even the patient they feel like tingling sensation or like any niche behind eyes na inagami thaki jay. So it's like yin and yang, like it's an energy flow in our body. Yeah.
Okay, so do alternative therapy can do use korle parina na like along with other medical treatments. Tai jundo hanin and China kideba to contradict hoy na kiniga ase.
Basically, it's like it can go hand in hand.
Okay.
Because we look only or basically on the outward body day side again. So we don't prescribe medicine. That's why I think they can still have the medicine and they can still take treatment from us. Yeah. So
people don't have to choose only one specific therapy.
Yeah,
they can just hand in hand go along with it. Okay. So idea safety practices kan one sign na jai do side effects kan thagyala enya bi eko asna nai nului manuhan to be cautious na ki khan nishna hobo pare.
I think till today my dad and both of us in treatment the other we have treated I think more than 50,000 patients till today if we calculate from the past till today. So side effects too, I think we have no side effect as of now. Only be so it's like a natural way. So side effects, so I don't think it has major side effect. The only problem is that one sugar patient can do hushar thage because sugar patient do it's like it's a risk factor. So we have to first check their sugar level, or sometimes we have to check the BP blood pressure first, because sometimes not every patient is same. So some patient do bui khain thage na. So we check first the blood pressure, their like sugar level can first check with you. But the most important thing is we ask their medical history, whether they have gone through medical checkup or no. Our sign patient kumadu any sign up severe can do, we don't give treatment, but we recommend them to go for medical treatment first, or sometimes we ask them to talk to the doctors whether this treatment is like advisable or no. So if the doctor says it's advisable, then that's how we give treatment. So yeah.
Okay. So alternative therapies kando, is it officially recognized by health ministries or any India de medical bodies kanna any ka recognize kurala do asma kiniga ase?
Yes, alternative therapy is actually very vast. There are a lot of therapy under alternative therapy. So acupuncture is also under Ayush. Acupressure and acupuncture they are under Ayush. But it's like I say, it's a lot. Actually, there are a lot of therapy under. Yeah.
So, idea misconceptions or any public opinion can be bishi thagina edwan labode do. Any kunba manuhando misconceptions kan thagina apni han bi janina thayo pare.
For sure.
So, edu misunderstandings no libi misconceptions kan thagya se ule do apni ki nishna kan clear korle mun chai.
Basically, their fear thagya. So we use fine needle. At the one time you see use one acupuncture needle na. So sometimes people have needle phobia. So we don't know needle bui khai, or maybe after needle itu treatment the side effects can bui khai. But for those people, I think they can start with prevention therapy. So in prevention therapy, we don't use acupuncture. So we first let them like feel, like the acupressure can, guasa can, or cupping can. You don't first use kuna. If they need, then maybe acupuncture, kita use kore. So that's how they gain, like tala fear to overcome great first too. But I think a lot of people they are fear of needles.
Yes,
So
exactly.
yeah, that's
So etia aji Nagaland la context e sai shugule do etu alternative therapies can be all of uthianish na be mon dikhi paise.
Yeah.
So especially among younger people who we are tangor manuan who we kiniga respond to kurina ayase.
I think now it comparatively when we started, I think it's much better now. So people, because like it's our patient are the testament of what we are doing. So patient is like mono any first they will do just like mouth to mouth. So people who got relieved or who got healed, they pass on. So how do I think it's better now. But I think even like famous sports person can.
Okay.
So they are basically the UFC fighter can. They use this traditional therapy. So whenever you see them, you see the mark of the cupping can, wasa can. So even those people they are using. So it's like an awareness.
Okay.
Yeah.
So one Nagaland lade sai shugule do do real life impact na.
Yeah.
Iniga apni ida mention garnish na any famous personalities kan be
right.
sportsmen kan be kun kan nishna wa ahina apni han lode ne therapy loina tahan phal hui jala na iniga success stories kan apni ase gule do. I mean of course thayu so if you would like to share on that also.
So we are very fortunate to have some doctors. So because we need each other, so we also need doctors' help. They also need us. So that's how it's related. So we have some doctors who are our patient, and also I remember like giving treatment to our former health minister.
Okay.
Yeah. So that was fortunate for me, and also some MLS. So we also do home service.
Okay,
So sometimes we go there and give treatment. Yeah. Also, we are fortunate to have our former medical director. So he also comes like to detox the body, to distress the body. So we are fortunate to have those people. Yeah.
Okay. So itia closing nulubi any personal insight. Any for someone who is a first timer nishnana or someone who is very new to this alternative therapy treatment. Tahan bi edu saigina nulubi ni huni na dan alternative therapy duan lole munja se gulo apni la side de brado ki advice to munja wa nulwi tahan they might be hesitant na apni konishna everyone is I mean almost all of us are scared of needles na so if they are hesitant to try apni la advice to ki hobo like tahan ge ni safe ase aigina try korole enya na
Right. So our main focus to it's a prevention therapy, like I said. So because many of the problems are linked with stress issue also. So when you have a lot of stress, then the BP uthi jai. I think there are a lot of problems or health elements is linked with stress issue also. And this generation, everybody is stressed up with their works or anything. So in the I think prevention therapy I can recommend. So whether you are sick or not sick, you can just take this prevention therapy to distress your body, detox your body. Like even muscle tension can be relieved quick. So I think it's a safe therapy that everybody can take. So what we recommend is like if you don't have any problem, then you can at least maybe do one session in a month. Yeah. Or if you are stressed up, all of stress, calm stress, we can do 2 sessions. Yeah, that's like just prevention from like other ailments that can occur. So prevention therapy you can start first, and after that maybe if you have back problems, shoulder problems, you can use acupuncture, but it's not that painful also. It's a painless. Yeah.
Okay, so edu therapy treatments can do any chronic patients can be ahina luina thakyala bi thayo. So in such cases na kidewo any government la scheme under the coverage kuriala any ado eku asana na itia takto.
So far I think itia takto inado nai. And maybe we have not approached also. But I hope someday the government also can see the importance of this because it's a complementary. So yeah, hopefully someday.
Itia apni rough idea nishna thayo na nai to monla Nagaland do acupuncturist ka kiman nishna thayo nishna where people can just approach them na.
Right. I think there are a couple of center in Dimapur also, I think,
Okay.
and even like in Kohima. And I think a lot of physiotherapy, they are also using acupuncture.
Okay.
Maybe they call it like dry needling because they can see the benefit. It's really beneficial treatment.
Okay,
Yeah.
okay.
So our treatment center is at 7 Mile. So it's Engineer Ketavi Complex.
Okay.
It's new. So if anybody wants to come and take treatment, it's open. Like I said, we have like therapy, prevention therapy is different. It's to prevent any kind of problems in the future. Also, we have like those combined alternative therapy, so you can
Okay.
come and like experience yourself.
Okay.
Yeah.
Okay. So thank you so much. Before we wrap up our conversation, any apni etia mom bhawa koi dishe like stress can hobi eduhan relief kuro
Right,
aro
right.
any certain pain in some certain areas eduhan thagi shegule do apni han eduhan side na. So
Right, right.
if you can just show us like 1 or 2 pressure points, supposing like we stress thagi shegule do,
Right, right.
which are the areas that I should be putting pressure to relieve of my
Yeah.
stress na Anika, if you can just kindly show us.
Sure, sure. So I have my assistant here, so
Okay.
I will let him do the distress.
Okay.
Yeah, so basically our palm of our hand reflexes our organs. So I'll just show you some few points that you can try. If you can lend your hand here. Okay, then basically this here reflexes our stress point. So if you press here and you feel some sharp pain, that means you have a lot of stress. This one, that's the stress level. Okay, and then this one, the left side, it will reflect your heart. If you have problem in your heart, then you'll feel some sharp point. This one, it reflects our eyes, and here these are sinus point.
Okay.
Yeah. And then this is our lungs. Like people who have asthma, they'll feel some sharp pain here. Yeah. And then people with diabetic patients, they'll feel some sharp point here. This one. So yeah. So these are the points.
Okay. Okay, so thank you so much apni laga assistant Mr. Verazo. Taibrabi pressure points can be power dishe, and even you as well for joining and then sharing your insights. Apni laga knowledge mon ge share gori arne. Thank you so much. Etu thaka se aji laga topic alternative therapy treatment la opori mon korina chala. So edu nishna arwi alag alag health topics kan la opori mon every month anigina apni hange janकारी awareness kan digina chavo. So eniga nishnaro for more health talks keep watching Hornbill TV.